Imagine this. You're about to have the most intimate moment with your partner, but your body simply doesn't respond. Anxiety builds, frustration grows, and what should be pleasure turns into panic. But what if I told you there's a solution in the form of a cream that thousands of men are using right now? And it could completely change this situation in less than 10 minutes. Today we're going to talk about something that many doctors know about, but few dare to mention openly. Topical Alprostadil. That mysterious ointment that's revolutionized the treatment of erectile dysfunction. And no, I'm not talking about those miracle creams you see in shady ads. I'm talking about real science, backed by clinical studies and approved by regulatory agencies. But before you rush out to get it, you need to know something crucial that could make the difference between success and total disaster. Let me tell you the story of Carlos. Carlos is 42 years old, in excellent physical shape, doesn't smoke, exercises regularly. But for the past 2 years, something changed. At first, he thought it was work stress. Then he blamed it on age. Later, he pointed to his relationship. The reality is that Carlos, like millions of men around the world, developed erectile dysfunction. And here's the interesting part. His problem wasn't psychological or hormonal. It was purely vascular, a blood flow issue. Carlos tried the famous blue pills, but the side effects were unbearable. Headaches that lasted hours, nasal congestion so intense he could barely breathe, and chest pressure that made him feel uncomfortable. That's when his urologist told him about Alprostadil cream, and it changed everything. But what exactly is Alprostadil? This is where things get fascinating. Alprostadil is a synthetic prostaglandin E1, that is, a lab-made version of a substance your own body produces naturally. This molecule has an extraordinary ability. It dilates blood vessels directly in the penile tissue, increasing blood flow in a localized way. It doesn't affect your overall blood pressure, doesn't interfere with your heart. It acts exactly where it's needed. And here's the first fact that'll surprise you. Unlike pills that you need to take 30 minutes or even an hour in advance, topical Alprostadil starts working in 5 to 10 minutes. Yes, you heard that right. Less than 10 minutes. That's because it doesn't have to go through your digestive system or be metabolized by your liver. It goes straight to the point. But hold on, because there's something you need to understand before we continue. Alprostadil isn't like those over-the-counter creams that promise miracles. This is a serious medication that requires a prescription, and there's a very important reason for that. Improper use can cause adverse effects ranging from local irritation to priapism, which is a painful erection lasting more than 4 hours that requires urgent medical attention. Now, back to Carlos. His doctor explained exactly how to use the cream. The first golden rule, the exact amount. We're talking precisely measured doses, usually between 100 and 400 micrograms. It's not something you eyeball. The cream comes with specific applicators that let you measure the exact dose. Carlos learned that more isn't better. In fact, using too much only increases the risk of side effects without improving results. The second crucial rule, proper application. It's not just about rubbing the cream anywhere. Alprostadil must be applied to the tip of the penis, specifically in the urethral meatus, that small opening. Why there? Because from that point, the medication is absorbed optimally into the corpora cavernosa, those spongy structures that fill with blood during an erection. Some then make the mistake of applying it to the shaft or base and then wonder why it doesn't work. Here's something many informational leaflets don't tell you. You need to gently massage afterward. We're not talking vigorous friction, but a soft, circular massage for about a minute. This helps the medication penetrate the skin. And yes, it might feel slightly cool or cause a mild tingling sensation. That's completely normal and a sign that it's starting to work. Carlos also learned something fundamental about timing. Unlike what many think, You don't need to be fully aroused to apply the cream. In fact, you can apply it in a relaxed state. Alprostadil initiates the erection process independently of sexual stimulation. However, and this is important, sexual stimulation significantly improves the results. It's not automatic magic. It's a powerful aid that works best when there's desire and arousal. But here's the part no one tells you in the leaflets. Communication with your partner is absolutely essential. The first time Carlos used the cream, his partner felt confused. Could they kiss? Was oral contact okay? Was the cream safe for her? These are legitimate questions with specific answers. The answer is yes, but with important considerations. After applying Alprostadil, you should wait those 5 to 10 minutes before direct contact. And if there's going to be oral contact, it's advisable to gently wipe away any excess cream with a tissue. Although Alprostadil isn't toxic, it can cause mild irritation to your partner's mucous membranes. Some doctors recommend using a condom during the first few applications until both partners feel comfortable with the process. Now let's talk about real effectiveness. Clinical studies show that topical Alprostadil has a success rate of about 60 to 70% in men with mild to moderate erectile dysfunction. That means 6 or 7 out of every 10 men achieve an erection sufficient for penetration. But here's the detail. Effectiveness increases with correct and consistent use. Carlos noticed that the first few times the erection wasn't as firm. But after 4 or 5 applications, his body seemed to respond better. And what about side effects? Let's be honest, no medication is free of them. The most common with topical Alprostadil are local: redness, a feeling of warmth or mild burning, and occasionally some penile pain. These effects are generally temporary and decrease with use. However, there are more serious effects, though rare, that you need to know about. Priapism, that prolonged, painful erection I mentioned earlier, occurs in less than 1% of cases, but it's a medical emergency. If your erection lasts more than 4 hours, you need to go to the ER immediately. This isn't a joke. Untreated priapism can cause permanent damage to penile tissue. Carlos always kept this information in mind. Not to scare himself, but to be prepared. There are also rare cases of allergic reactions. If you notice severe swelling, difficulty breathing, or hives, you should stop use and seek medical attention right away. And something that surprises many, Alprostadil can interact with other erectile dysfunction medications. Never, and I mean never, combine the cream with pills like sildenafil or tadalafil without medical supervision. This can cause a dangerous drop in blood pressure. Now, let's talk about something practical. When is Alprostadil really appropriate? Not all cases of erectile dysfunction are candidates for this treatment. It's particularly effective in men with vascular origin erectile dysfunction, like Carlos. It also works well in cases with a psychological component because it breaks the performance anxiety cycle. Once a man knows he has a reliable backup, the anxiety fades, and eventually, some can even reduce the frequency of use. But there are cases where Alprostadil isn't the first choice. If you have a penile deformity like active Peyronie's disease, a history of priapism, or certain blood clotting conditions, your doctor will likely suggest other alternatives. There are also age considerations. While there's no strict limit, older men with multiple medical conditions need a more careful evaluation. Here's something fascinating that Carlos discovered. Alprostadil didn't just improve his erectile function, it was positively impacting his relationship. Spontaneity returned. There was no more pressure to plan everything an hour in advance. A 10-minute wait is something that easily fits into foreplay, into intimate connection. His partner noticed he was more relaxed, more present, less focused on performance, and more on mutual pleasure. But Carlos also understood something crucial. The cream is a tool, not a magic solution for all problems. He continued working on his overall health, managed his stress better, and improved communication with his partner. Alprostadil gave him the time and confidence to address those deeper aspects. Let's talk about costs because it matters. Topical alprostadil isn't cheap. Depending on the country and insurance coverage, it can cost between $30 and $100 per applicator or tube. This might seem like a lot, but when you compare it to intracavernosal alprostadil injections, which are more invasive, or the accumulated cost of brand-name pills, the price becomes more reasonable. Some insurances cover part of the cost with a justified medical prescription. And here's a controversial point. There are generic versions and compounded formulations from pharmacies. These can be significantly cheaper, but quality and concentration can vary. Carlos decided to start with the brand name version recommended by his doctor to ensure consistency. And only after understanding how it worked in his body did he consider more affordable alternatives under medical supervision. Now, something many wonder. Can you use alprostadil indefinitely? The short answer is there's no set time limit. But there are considerations. Chronic use can, in some cases, lead to fibrosis or tissue hardening if overused. The general recommendation is not to use it more than 2 to 3 times per week. This also helps maintain the tissue's sensitivity to the medication. Carlos established a pattern. He used the cream when he knew intimacy was planned, not as a daily habit. This also helped keep some spontaneity in his sex life. Some days, he relied solely on his natural function. Others, he used the cream as backup. Over time, he noticed his confidence had grown so much that he occasionally didn't need it. Is there anything else you need to know about storage and handling? Alprostadil is a relatively stable molecule, but it should be stored in a cool, dry place away from direct sunlight. Don't keep it in the bathroom, where humidity and temperature changes can degrade the medication. And always check the expiration date. Using expired alprostadil isn't just ineffective. It can be potentially irritating. Now comes the million-dollar question. Are there natural alternatives that work just as well? The honest answer is no. There are supplements and creams with L-arginine, ginseng, or yohimbe extract that claim to improve erectile function, but none have the scientific evidence or proven effectiveness of alprostadil. If you have real erectile dysfunction, don't waste time and money on products without scientific backing. Consult a professional. Carlos learned this the hard way. Before seeing a doctor, he spent hundreds of dollars on supplements and natural creams that promised miraculous results. None worked. Not because natural substances have no value, but because the concentration, formulation, and delivery method simply aren't optimized to be truly effective. Let's now talk about a sensitive topic: mental health and erectile dysfunction. For Carlos and many men, erectile dysfunction was more than a physical problem. It was affecting their self-esteem, their identity as a man, their relationship. Alprostadil was important, yes, but equally important was talking to a therapist specializing in sexual health. The combination of medical treatment and psychological support was what truly transformed his experience. If you're considering alprostadil, my recommendation is to also consider talking to a mental health professional. Not because you're crazy or because it's all in your head, but because human sexuality is complex, and addressing it from multiple angles will give you better long-term results. So, what's the final verdict on topical alprostadil? It's an effective and relatively safe tool for many men with erectile dysfunction, especially those who don't tolerate oral medications well or prefer something with faster action. It's not perfect. It has its limitations and requires careful use and medical supervision, but for the right candidates, it can be truly transformative. If you identify with Carlos's story, if you've been dealing with erectile dysfunction and feel it's affected your quality of life, don't suffer in silence. Talk to a urologist or sexual medicine specialist. Alprostadil might be the answer you've been looking for, or they might suggest other equally effective options. The important thing is to take that first step. Remember, Erectile dysfunction isn't a personal failure. It doesn't define your masculinity. And it definitely has solutions. Modern medicine, like Alprostadil, exists precisely to help you reclaim that important part of your life. It's not vanity. It's not superficial. It's health. It's well-being. It's quality of life. And one last thing. If you decide to try Alprostadil, be patient with yourself. The first application doesn't have to be perfect. It may take a few tries to find the right dose, the right timing, the right technique. Carlos needed 3 applications to really feel like he understood how it worked for him. Don't get discouraged if the first attempts aren't exactly as you expected. Sexual health is an integral part of your overall well-being. You deserve a satisfying sex life, no matter your age or medical history. Alprostadil is a powerful tool in modern medicine's arsenal, and when used correctly under professional supervision, it can make a significant difference. Your journey to reclaiming your confidence and sexual satisfaction starts with accurate information and the decision to seek professional help. Take that first step today.